Hello everyone. Today we're going to be talking about why your gums bleed and why your dentist may say you need a deep cleaning. I'm going to be answering all the questions that you have about what is gum disease, what is gingivitis, and what is periodontal disease. This is the third episode of Dentistry Decoded. Why do my gums bleed? This is Dr. Tamisha Denis, and this is The Modern Smile. So oftentimes people will go to brush their teeth and they will go and spit and see blood, or maybe they're flossing and they see blood on the floss and they think that is normal. Bleeding gums are not normal. So today we're going to talk about gum disease and gingivitis, and you can determine if you have gum disease and maybe you need to see a dentist, or if you've already seen a dentist and they've told you maybe you need a deep cleaning. What exactly does that mean? So in order for me to make it very simple as to what is gum disease, what is gingivitis, and do you have it, I'm going to split the different categories of gum health into two categories. And as I describe from a perspective of what you see at home person and what does the dentist see or the dental hygienist see when you go in for your cleaning or when you have a dental exam. Hopefully that can help you to see what category you're in exam. So we're going to start for a baseline. Baseline is healthy gums and bone. You don't have any inflammation, nothing hurts, everything feels pretty good. You're probably flossing and brushing on a regular basis, and there's really not much to note. Healthy gums can be pink or they can be pigmented. Some of us brown people, we have some darker pigments in our gums. That is perfectly healthy. Your breath is fresh and you feel pretty good. So let's talk about gingivitis. Typically, someone who has gingivitis will notice some bleeding when they brush. Maybe not all the time, maybe in certain local spots. Sometimes we call localized gingivitis, and sometimes we'll say generalized, meaning it's everywhere or it's just certain spots. They will maybe notice a little bleeding sometimes, maybe sometimes not, depending when was the last time they had their teeth cleaned. So if you're brushing and flossing, you get a little tinge here and there, but for the most part, you don't see a lot of puffiness or inflammation. We can maybe say from the home perspective that you might have gingivitis. Now, when you go into the dentist is going to take x-rays and they're also going to do a cleaning and exam. And at that appointment, they can tell you if something else is going on that you can't see with the naked eye. So someone with gingivitis, they may see some inflammation in your mouth. We also say bleeding upon probing. That means when we stick our instrument in between your gums, sometimes you'll see a little blood come out. Maybe not everywhere, maybe in certain spots. The periodontal probe, really quickly, is a measuring device that has different millimeter notches on it. So it'll have 1 millimeter, 2 millimeter, 3 millimeter. Usually it skips 4 and it goes to 5, and then it'll go to 7 and 10. So when we stick a periodontal probe between your gums and your teeth, not painful, by the way, when you stick it in there, then we will see how deep the periodontal probe goes, and depending on how deep the periodontal probe goes, it will tell us how healthy your gums are. So if you have a little gingivitis, you might have 1 to 3 millimeters, and that also goes for healthy. Okay, what the dentist will also see on the x-ray is that you have no bone loss. So when you have plaque around your gums, what happens is that plaque will irritate your gums, make you bleed. That's why the word gingivitis says gingivitis. Gingiva, which is gums, and vitis means inflammation. So if that plaque is removed, you're done, you're healed. All you have to do is get a cleaning and you are good to go, back on track. That's why we recommend you to get a cleaning every 6 months. Now, if you continue to watch this video, that's because maybe they said something else to you. So the next stage is what we call early periodontitis, early periodontal disease. Early periodontal disease means now your bone is affected. That means that plaque that's around your gums and your tissue is actually, and on your tooth, is actually causing inflammation to the point that your bone is running away from your tooth. Your bone is running away from your tooth. And all that means is that it doesn't want to be around that. And if you don't remove it, it will continue to go down. So with early periodontitis, if you look on an x-ray, sometimes we'll see something we call radiographic calculus, which means that we can actually see the plaque that's on your teeth on an x-ray, and they'll look like little flecks on the side of the teeth. Now, a lot of times there are people with really good hygiene. That means you take really good care of your teeth. And I look at you and you look pretty good. And then we go to take x-rays and I see big chunks of plaque on your x-rays. That means we are going to start discussing deep cleaning. And deep cleaning simply means when we're cleaning your teeth regularly, we call that a prophy. And the word prophy just means prophylaxis. That means preventative. We're starting to prevent gum disease. But once you have gum disease, what we do is we have to go deeper below the gum to remove those extra flecks, right? So mild periodontitis means that we're just getting, that we don't have a lot of bone loss and we have that flex and we need to go underneath and scrape that all off. Now, we talked about the periodontal probe and the periodontal probe. If we stick that in between your gums and your bone, it goes deeper. Typically, that's about 4 millimeters, right? So we stick that in between, slide it down, and it goes a little deeper than a healthy person. Then we have moderate. Things are not changing. We're just kind of, all the symptoms kind of gather. We got the bleeding. Now we have the plaque. Now we have the bone loss. Now we have a little bit more bone loss. And if we stick that probe in, maybe we'll get a 5 millimeter pocket. And that means that the tooth is not getting anchored to the bone as good as it was before. The last one is severe periodontitis. Severe periodontal disease is nothing to play around with. Typically, somebody with severe periodontitis still doesn't have any pain, which is crazy to me. But there's nothing wrong with their tooth per se. It's the bone and the gum that are holding their teeth in place that are all messed up. So if at that point we start to have shaky moving teeth, do you know what we start to talk about? We start to talk about pulling your teeth. Deep cleaning is still an option, but for the most part, we're scared you're going to lose your teeth. And it's really important for us to intercept all of those bad things before we get to severe gum disease, because once we get to severe gum disease, we may not be able to save your teeth anymore. So that's why it's so important to go to your dentist on a regular basis, because these things are not painful, and it's so important for us to catch them early so we can keep you from losing any of your teeth. Because once we get that scary word called mobility means your teeth are moving, there is not much we can do to screw that tooth back in place. I can't just say, oh, let's tighten that baby back up. It doesn't happen like that. So it's really important to catch these things early, treat them, and prevent as much as possible for you to go from early, moderate to severe. So the last thing that I'm going to note about gum disease is that all of this is preventable. Most people that don't have a severe genetic component to their gum disease, most people, it's really because they've skipped so many dental cleaning appointments. They feel really good and they're like, I feel fine. I brush my teeth. I floss. I do everything that I'm supposed to do. I don't see any brown marks on my teeth. I'm good. But they can't see what's lying beneath. The reality is you can have great oral hygiene and still get gum disease. I joke with my patients all the time and I'll say stuff like, well, if you could do it all yourself, I wouldn't have a job. My dental hygienist wouldn't have a job, because that means all you have to do is brush and floss and everything is great. But the reality is that's why you need a little extra help. If you think of the age-old people, all of them used to get long in the teeth. All their teeth fell out and they couldn't eat anymore. So right now in the modern day, in modern dentistry, we have so many things to keep our teeth long term. We're living longer, we're taking care of ourselves, and in that we need to make sure that we guard ourselves not just against cavities and root canals and wisdom teeth and extractions, but we have to make sure that we're taking care of our gums and our bone, so when we're 90 something we still have teeth to chew with. I hope you learned something about why your gums might be bleeding, and maybe if you haven't already, you need to go to the dentist and get that checked out. If you have any questions about what I talked about today, please make sure to comment below. I'll be glad to answer them for you. And if you learned something and you like this video, make sure to give me a thumbs up and subscribe to the channel if you haven't already. Thank you for watching.